thought we can discuss so fast this Derma, Psycho, and Anaesthesia, the most important topic for Neet PG 2025. So please never ever skip these topics. So I'm going to say this video so fast, so because I don't want to waste your time, as well as I don't want to increase my storage place also. So dermatology, if we're starting with dermatology, start with STA, all sexually transmitted diseases. That is going to be very important because you get a table, that beautiful table, and that there are certain color coding like in genital ulcer disease, herpetic, which it is color is red. So what is the treatment? Very important, because in 2023 and 22 they have given a question that gray wala what, green what. So gray, what is the color? What all thing is coming? Like whether it is if it is vaginitis, it will be in green, and if it is cervical discharge, it will go to green. So there are difference. So please learn that as well as learn the treatment part. So start with that. Then and all those things, where do you see that school fish appearance, hemophilia, ducree, that's all pictures, beefy ulcer, where do you see syphilis, voila, all with pictures, please do it. And picture bank, you want to main focus derma, anesthesia, always give importance for diagrams and all that, vitiligo and all, what color we'll be seeing in that, all those things, coral red color, where that's vitiligo, ivory white you see in wood's lamp, and all those things, please learn it. And also psoriasis is very important, just read it, histo, what you see, and all those things, very important. Then the most important is whether how to identify pemphigus vulgaris as well as bullous pemphigoid, which with the diagram please learn. Acne vulgaris and all, just read and go. And this hyperkeratosis, sawtooth appearance, where do you see? Very important, that's lichen planus, voila, all those important, very important, just read and go. And where do you see erysipelas and all those things, streptococcal and staphylococcal infection, there are like honey colored, the child is child photograph, honey color thing, impetigo, that's all very important. That is mastitis in link with surgery, they have been asked, please don't skip it. Herpes zoster scabies is an all-time favorite, and also with micro they can integrate and ask that Madura food mycetoma, what all thing causing, very important. That 2021 they have asked that Kirion one picture, one scalp voila, that thing they have asked to identify, so it's very important. Leprosy, the treatment part, they can integrate PSM, so just read and go. And those pictures, Gottron papules, that in 2020 they have asked, so never skip it. And all those things, that SLE voila, lupus, what you see, that's all with diagram, you can finish it off. That Sjagren's patch, that adenoma sebaceum, that is corners tumors, that's all with picture you can do. That's that spot wine stain, Stark-Weber syndrome, very important. Tram track calcification is very important. With X-ray they can link and ask. Tuberous sclerosis, what do you see? Subependymal nodule, voila, that is all-time favorite question. So always first read, that's previous year questions of the dermat. See, dermat will be mostly easy, so with diagram please finish it out. Then next we are moving with psychiatry. No, before psychiatry we are moving with anesthesia. So anesthesia, usually less than 5 questions only, so always give importance for pictures, because in 2022-23 we have seen so lot many pictures, so please give importance for pictures. Yes, so don't miss all those things. That is that Malampati score wala, the diagram wala, NPO, how is that NPO, like breast milk, that NPO clear fluid like 2 hours before surgery, that breast milk what is hours, that 4 hours, very important. Bispectral index, because 2023 they have been asked a question about that, BIS, depth of anesthesia for what, and all those things. And they have given a hand and one this thing they have given, that is neuromuscular monitoring, that is for which common now, that is in ulna now, this side itself, ulna side itself they have kept, so that's all common sense wala questions, please never skip it. And also then Mapleson circuit, yes, please read and go. And also that cylinder wala color coding and all those things, also just read and go. And that is cylinder, that air then body wala, body shoulder color, that pin index 2022. I think there was a question, so just read and go actually. Then oxygen delivery devices in 2000, yeah, 22, 23 they have been asked, so please don't skip it. What is that percentage? Wala, that is very important. That NIV, Hudson mask, nasal cannula, that the rate and the maximum flow rate you want to study. That's all time favorite. That non-rebreathing mask, they have put the picture of the non-rebreathing mask and they have asked to identify. So that flow rate, voila, that is very important. Please study the diagram. If you are following MAR also, you have got plenty of that picture voila image. Please do learn it. And also about regional anesthesia, there are certain like in obesity, you don't give this, renal, you don't give this. That's all time favorite. So many questions. Most cardiotoxic, voila, that is bupivacaine. So what is the action of lignocaine and all those things? There are so many questions every time asking. So that will be in your MCQ things. Please do revise. And also the previous year questions all time. Anesthesia wala, please do it. Spinal, where do you give? That's all. That what is the difference between that epidural wala, epidural needle and spinal needle wala? Just read and go. That there are certain like this, like which is a cardio stable, what anesthesia you prefer. In children, what do you prefer? Children, which one is the pungent wala? That's all very important. Most potent is what? Most potent and the least potent. Most potent is methoxy, yes, fluorine, and the least potent is N2O. That's all very important all time. The renal, elderly, obese, desfluorine. So like that in asthma, like all those things that will be in your marrow. If you're following panel also, very beautiful tables also there. So vaporizer, color code, very important. This fluorine, desi fluorine, that's the blue color wala. That's all very important. Please learn it. So general thing, please don't skip it. And as well as the malignant hypothermia, very important. That succinylcholine wala, that's all very all time favorite. So which causes like asthma? What about the ketamine? Ketamine, where do you use? Which one induce attack of porphyria? So where do you contraindicated in porphyria? That is barbiturate. Very important. So many questions like muscle relaxant. Which are the polarizing wala? Which are the depolarizing wala? Very important. Which one causes hypokalemia? That's all very important. Malignant hypothermia causing succinylcholine, very important. So one line wala, please learn. Very important. Opioid, which one is morphine contraindicated in biliary colic because it causes a sphincter of audit contraction. That's all thing. And in 2022 they have been put so many pictures to identify that head tilt wala, chin. That's all very important. The tracheostomy, 100% there will be a question because they are very fond about this tracheostomy. In and out, please learn. That BLS wala and all those things in children, how it is, and CPR wala, that's all just read and go. Next we are moving about the psychiatry. Psychiatry, very important, is all-time favorite is, I will tell, eating disorder. 100% there going to be a question. Eating disorder, that anorexia nervosa, bulimia, binge, based on the clinical scenario they'll be asking. Please don't skip it. Then one-liners, there are so many one-liners like delusion with hallucination, that is psychosis. Only delusion, no hallucination. That's that is in delusional disorders. And that schizophrenia wala, that's all. Please read and go. And also very important is sleep physiology, that is NERM sleep. What are the factors like night terror, bruxism, somnambulism, you see in NRAM. Nightmare means what? MARE, mare, that is an REM. That's all very important. That Wayvala, please learn it. And about drugs of abuse, that is forensic, they can integrate and ask. That LSD wala, bad trip flashback, you get in LSD. And paranoid hallucinatory syndrome, schizophrenia, like amphetamine, that's all one word. Like dissociative anesthesia, you see in ketamine as well as phencyclin, fairy. That's all very important. And also you want to learn the disorders of thought, because this is a very pocket area of asking a question for the examiners. That disorders of thought, the disorders of form of that flow of thought, what is coming under the like flight of idea, retardation of thinking, that's all things. That's many things is coming like that will be asking. That tangentiality, delineament, neologism, That's all comes under form of thought. So there are standard books, please read and go. Very important, like content of thought, what is coming under, like delusion, derealization, ideas of worthlessness, ideas of hopelessness, like exam postmortem. That's all things that you can remember. And content of thought. So what's the comes under all time favorite. Then delusion wala and all those things, Othello syndrome, and all Fragoli, Capgras, very very important, because Capgras and Fragoli, they always make certain clear scenario and used to us. Hypomania, mania, schizoid, what is about that? Class A, class B, class C. Please don't skip it. Histrionic, that's borderline is histrionic. That Raki Savant, how she behaves like histrionic, that antisocial, narcissistic. That's all very important. What's all comes under A, B, C? That's all important. Drug abuse wala, opioid thing. That's all very important. And also, like, how do you identify if it is less than 18 years clinical scenario? They'll be giving and to identify, that is conduct disorder. And if it is more than 18, is anti-sociality and all those things. That's you can do with the cases, you can do with clinical scenario. See, yeah, D2 partial agonist is aripiprazole. So every time they'll give you a like pharmacology, they can integrate, will give you a drug and you want to find out. See, a typical causing maximum hyperprolactemia is always risperidone. Very important, antipsychotic side effects, Alzheimer's, antidepressant, lithium oil, all-time favorite, and all those things. So that is eonism, fracturism, exhibitionism, necrophilia. Very very important, very very important, that because last time also from this thing there was a question, like they linked with forensic and asked. So very very important, please never skip it. And also I'm speaking about the radiology also, I will just touch and go. See, radiology, see any picture they can ask. That child wala one trachea, one coin, the trachea, whether it is that esophagus or is it in the, there are that coin shape wala na, that is very important, please learn that. And also they have asked about how to identify like CT scan of heart, they have asked once. It's not echo, like CT, as well as that heart wala, please look. Please don't skip it, CT wala and all those, just read it. What about the newer thing like flare wala, all those things. And also CT is very important, please give importance for the newer techniques also, because diffusion weighted MRI, just look all those things. And they can GIT, they can actually integrate with surgery while and ask that big appearance, achalasia and all those things, very important. So GIT intussusception, how is it? So if you know the basic, if your concepts are clear, see X-ray is going to be very fabulous. At the same time, like CNS hemorrhage, like SADH, how it will be, extradural, how it be, the general things, please learn and go. And also what I want to say, like newly all items, please learn. Do have questions, because radio is going to be easy if you know the concept. Radio is very easy, because last time they have last day they have integrated so many questions and they have asked. So it was me, Dr. Amrita here. Thank you all for listening me. And if you want me to put in some other things, please do comment in the comment section. I think I have almost covered most of the subjects. Just I'm going to end all this kind of videos. So yes, always hope for the best. As always says, difficult roads often lead to beautiful destination. Of course, you will definitely get your dream branch. Never ever think about the outcome. It's already God have written you. You will definitely get it. Don't tense and don't get over tensed and lose that precious seat. And it's me, Dr. Amrita here. Thank you guys for listening. Thank you.